So my name is Marisa. I've been diagnosed with PV since last June, and but I've been sick for more than 3.5 years, 4 years almost now. And in the beginning, it was going from doctor to doctor and to hospitals, and finally they found something after a long time of research. The biggest problems that I had in the beginning, I think in the really early beginning, I slept about 6 weeks, about 18 hours a day. So I was completely
Exhausted.
completely, yeah. And so afterwards, the brain fog started. It still does, actually. So that's a thing that sometimes I just forget what I'm doing, what I'm saying, or whatever. And so there was a big problem for me with work. And finally, first I was on disability, and now I'm completely not sure what it's called, but I don't work anymore
Yeah.
because I don't have the energy for it. So the energy that I do have, I only use it for things that are good for me or that I like to do. All the negative things, negative people, throwing them out, and only try to do positive things for me, for my body, and trying to stay positive. That's actually,
Sure. But what
in very short, what I do.
what is your medication which you're taking?
I have a Pegasus.
Pegasus.
Yes, and I started in June, and I think finally now my HT is under control. And I also have the blood thinners because last year I was in the hospital with the thrombosis. And I also have the blood pressure medication.
Okay. You know, interferon, Pegasus, it's like a train, yeah? It starts very slowly and
Yeah.
it takes some time to get to cruising speed. So you have to be very patient with interferon. But I think it's a good product. I always like interferon because our body is producing interferon, so it's not something, very strange you put into your body. But it's obviously I think your life is very much reduced. It must be a very big burden for you, no?
No, not
No,
anymore.
you kicked it all off, yeah.
Yeah. In the beginning, I was really annoyed with myself because I wanted to do things that I couldn't. But I had different types of therapy. I had, I'm not sure what it's called, psychosomatische physio. So
Yeah.
that's sort of a physiotherapist for the brain, I think. That helped me a lot to let go of things. And I also have ergotherapy, and that helps me a lot with my planning, my day, looking at the end of the day how I did. Did I do too much? Did I do too little? What can I change? Should I take more breaks? That really helps me. And so it changed a lot because I was very outgoing, always working, always going out in the evening, having dinner with friends, and that changed a lot, but it's okay.
Do you consider that the illness is controlling your life nowadays?
No, not at all.
No.
No. I'm
You
glad though that it's not like that,
okay? That's
because
very good.
I mean, I do had to make a lot of changes, but I'm okay with that because it is what it is,
Sure.
and you cannot change it. So,
Yeah,
deal
yeah.
with it and go on.
Okay. You're satisfied with your physician?
Oh, very much.
Yeah.
Yes. Yes, but I changed a couple of times.
That's a normal way until you find the good one. Yeah, it's true.
Yeah. I have a great one.
Yeah, yeah.
And she also gives seminars about MPN.
I see. Okay, good. I'm no John is using her. I'm sure. Yeah.
Probably.
Okay. Thank you very much. Who is the next? I leave it really up to you.
I'll join in on that. I'm just actually getting a cup of tea.
Yeah.
So slightly different story here. Diagnosed with ET in 2019, and attempted for about 2 years to get back on the working wagon. I worked because as Marissa, I'm also on disability benefits completely. I tried to work really hard. So I did rehab for about 4 months and I tried loads of different things. Um, Sadly for me in the beginning, because I am really healthy, I don't drink, I don't smoke, I'm not overweight. I've only had thrombophlebitis, which is only a small thrombosis. I was not allowed to actually go on any medication, but the fatigue for me just really started to get worse and worse and worse. And after 2 years of trying, I had to accept that I couldn't work anymore and I couldn't do anything anymore. And that was tough, really hard for me. After finishing rehab with all the, like Marissa was talking about, different therapists, I had the same route. But in the end, every time I thought, okay, I now have it, I now know what I have to do to pace myself and to get the right energy and to get the right sleep. And every time it failed again because in the course of the months, I was actually getting worse. My physique was getting worse as well. At rehab, we realized I couldn't actually train to get more energy to get better because that actually made it worse. So um, there wasn't a lot I could do. Uh, uh, and what I've found out over the course of time is that I'm still actually going down as far as energy is concerned. So my physician decided last year that we could try. So I've also got Pegasus interferon, and that apart from lots of side effects, is having an effect on the thrombos because they're actually going down, which is good. But still, my fatigue is going down. So you actually see me now at the place where I sort of live. This is in the house on the couch. This is what I do. I get out of bed and I go here. I drink tea and try to do things, but it's a big burden because I'm not actually seeing um, fulfillment. So struggling with that mentally as well. So I've actually been last year. I started with a psychologist specialized in cancer, treating patients with cancer. And I was with him for about half a year, and we really got somewhere. And I really thought, okay, I now have it. I now know the level that I'm at, and I know how to go forward. And then again, my fatigue went down. Probably getting COVID along the way didn't really work for me personally, because it really got downhill after that. So at the moment, I'm actually struggling with eating, not really eating at all. Find it really difficult. So, which can be part of the interferon, but trying to figure out why. So I'm back with my psychotherapist and psychiatrist now, just to make sure that there's no things going wrong on different levels. And that route is now set for about a year and a half. So that's good because that's giving me breathing space. I try to be as positive as I can, but I can't say that I'm at the moment really enjoying the I have 1 square meter in which I sort of live my life. Whereas before I was extremely active.
It's amazing.
So that's my
yeah.
ET story.
Obviously, this is very extreme fatigue. But again, like the lady which died last week, it's not a unique case. These things are happening to some of our patients. And just a few details. She is one of the brains of MPN World. She helps a lot to make all the technical work. So her head is working 100% perfectly. I talked to her last week. She quit Pegasus and she's now taking hydroxyurea. And she's outside. So she's not anymore in her 1 square meter of living space, which, I'm getting more and more cases where simply the interferon is the causer of depressions, psychological problems. So when you see these cases, there is no question that you have a psychological charge, depending how your brain ticks, to take it one or the other. And both of them really were 100% dominated by the MPN illness. But, I simply say, how is it possible that you have these cases, and then I very often I compare with myself, and I can do it because I have PV. So how is it possible that I can work 12 hours a day, I'm tired at the end, which obviously everybody after 12 hours is tired, but I don't have the problems which they have. So if you take away the psychological aspect, there must be something different in her body compared to my body. So I'm talking to a researcher actually from the States, and we will see something tomorrow morning. Rao, he will give us some of his work. We are really trying through analytical data, deep analytical data of the blood, trying to find out, can we see any change, in the conditions of the blood of one patient or the other patients, where that difference is coming from. There must be something, at least this is me as a patient, maybe, hopeful thinking, but we find something which really then shows that, okay, because of this and this cytokines or whatever it is, this is why one is getting in a 1 square meter lifestyle, and another one, he can travel whatever he wants and he has no problems. So it's again, like I mentioned this morning, when you see these cases like a young woman or a woman is dying because of not receiving the right treatment, this is giving me the energy, and it kicks me. But I really want to find out why this is going to happen. So we are working very hard on that. And this is why it's also important that we get this information from MPN World in order to have a more wide information. Now, I mean, you're seeing a lot of patients, all 4 of you. How do you see this problematic of fatigue? I mean, it's there's no question it's something which is existing. I mean, in any report which you make, you have 50-60% of people complaining about fatigue. But it's not only in MPN. I think you have it in any cancer. You have also, the fatigue problem, and we have it in other places probably also. So again, this is my patient view, which is very basic. I just base myself on the facts. Maybe you can enlarge a little bit, all 4 of you.
So maybe I'll start, because it is something that our group has really been very actively studying now for a long time. So first, without question, it is the most common symptom across all 3 MPNs. When we looked at the MPN symptom assessment form data, including patients from Spain, there is no question that is the most prevalent symptom in all 3 diseases: ET, PV, and MF. Worst in MF, but then PV and ET, clearly. 2, like yourself, many have asked, is it all disease? Is it disease and medicine? Is it disease, medicine, and some other potential psychologic factor, which can include many things, from I have this rare disease, I have a difficult time relating to it, I don't know what the future holds, all of which can really contribute. There was a patient by the name of Zev that challenged us, and he said, I think that it's all depression. And I'm like, I don't think that's the case, but it could be a contributor. Why don't we do a study? So we actually, this is probably 10 years ago now, but we looked at 1,300 patients with MPNs. And we used both the symptom scores as well as different tests that help to screen for depression, anxiety, etc. And found that the rates in MPN patients were clearly higher than the general population. Probably not a surprise. a rare disease, limited information, uncertainty about the future. I think what you're finding is that there's multiple levels of what we call personalized medicine. So one, biologically, there's a big range. We know that, again, all things being equal, a disease is going to affect a different group of people in different ways for the biology of their disease, as well as the rest of their health, their age, their fitness, all that's a factor. 2, medications. I give 10 people interferon, and 1 to 2 out of the 10 just are going to feel poorly on it, and we need to eventually consider a different medicine. So, and there will be other people on it who feel amazing, and that's just medications, and that's true with any medication we use, whether for a blood condition or not. So I'm glad that she's doing better, and I think that's exactly the right example. In some people, one medicine is just, there's no one medicine that's perfect for everyone. It just never happens, because people are different in terms of their side effects or how it responds. And then third, there is that top level part of how we respond is incredibly variable. It has many, many different contributors, and it is not a personal weakness. Depression is not a weakness. Depression it can be even its own illness in terms of how someone might respond to a stressor. In the old days, you used to think, just suck it up. If you can just put your head down and get through it, and that is wrong. That everyone is different. So like the first patient, there are now, again, a variety of things that have been helpful for some individuals. How do you deal with a rare illness? How do you put it out of your mind? I will frequently tell the patients that I see, I give you permission to not think about your MPN. Things are stable, don't think about it until we see you again 3 months from now. Some people will really find interaction with other MPN patients and a lot of information really helpful. I will share that there's another percentage of people that might be overwhelming. So again, it has to be very, very individualized. But I think what you're studying is exactly correct, because it's an intersection of all of those things together. Disease, person, drug, and how we react to stressors, all of which matter, which means not one solution fits. If I see a patient that has really severe residual fatigue and the other aspects of the disease are in control, I clearly ask, one, is it the medication, or two, do they really need to see a psychologist as well? Or is there some other factor, another illness? They have hypothyroidism. They have some other illness that really has not been picked up that could be a contributor. But let me throw it over there to table B. Thoughts?
And ladies first, yeah? Otherwise we can't tell anything new.
I think the most important point here is that every patient is different, and there's no one solution or one problem that is equal to all patients, right? So we're genetically different individuals. We've had different experiences in life. So if you just take newly diagnosed patients without any treatment to think about, people will present in different ways. And so once we also take various therapeutic possibilities into account, then we also have to think about what's contributing to a particular symptom. So fatigue, which, as was just said, is the most common symptom here. So is their disease not well controlled, or is it the side effect of the medication? And I think that's usually the most difficult question to assess. And we don't have that many treatment options. So if a patient is on Pegasus and fatigue remains a debilitating symptom that is not controlled, then it's definitely time to try something else. And some patients are resistant because they feel that the disease is well controlled otherwise. Well, if the fatigue is debilitating, then clearly it's not well controlled. unless it's coming from the drug itself. So this is when I think switching therapies and trying something new is the right approach, and you can always go back to the previous treatment if it turns out that it wasn't the medication. And like Ruben said, of course, there's always other possibilities as well that could be contributing. So is it other stressors in their life? I mean, we still have families and jobs, and there are additional things that could be going on. So, try to assess for other things that are going on in their life. So they're not sleeping well. Could it be other medical conditions? Or could it be that that it truly is, depression contributing to it as well? I'll stop so you can ask a question.
Thank you. Hablando al hilo de la doctora.
Un momento, que
please.
tengo que cambiar el.
Ok. ¿Ya? Ok. Al hilo que. Me voy a quitar yo, porque si no me oigo doble. Al hilo de oír a la doctora, escucharles el tema de los, digamos, no nos funcionan unos medicamentos, cambiamos al otro, la fatiga no para. Yo les voy a contar en 3 minutos, si llega, lo que a mí me está sucediendo con Jakavi. El Jakavi, hace año y medio me diagnosticaron mielofibrosis. La verdad es que hoy por hoy estoy con un doctor, estoy muy contenta, un doctor Osorio, del Gregorio Marañón, y lo está llevando muy bien, lo estamos llevando muy bien, ¿no? Pero me guío mucho de él. Probamos con Jakavi. Resulta que fue muy mal. A nivel, digamos que a nivel sintomático, bien, esos dolores de cabeza tan grandes que tenía, esa fatiga, se corregía, pero con el tiempo volvía, ¿no? Tuvimos que dejarlo porque la hemoglobina bajó muchísimo, corría otro riesgo, y lo dejamos un poquito en stand-by, a ver si el cuerpo remontaba, o a ver si era el Jakavi, a ver si era la enfermedad que podía ir avanzando. Bueno, pues un poquito fue así. Resulta que oímos que salía momelotinib. Y él me dijo, Vane, creo que va a ser tu medicación. Creo que va a ser tu estrella, lo que necesitas hoy por hoy, porque digamos que es un poco muy parecido, tal y como me explica a mí el doctor, lo que me he podido informar, es un poco parecido a Jakavi, pero sí que es verdad que no afecta a la hemoglobina tanto. En el caso de que yo conozco gente que toma Jakavi, le ha ido fenomenal, era mi esperanza de que me fuera bien, pero es la segunda vez que estoy intentando tomarlo y sigue igual. Otra vez la hemoglobina está bajando. ¿Qué ha pasado? Al solicitar esa medicación nueva, por lo visto hay unos protocolos que o tienes la hemoglobina muy, muy bajita, o hoy por hoy no te lo administran, te lo deniegan. Gracias a que tengo un doctor que le considero muy, muy implicado, me dijo, no te preocupes, quien hizo la ley hizo la trampa. Vamos a bajarte a chorro la hemoglobina para que nos lo concedan, porque tú no puedes tomar el Ruxo. ¿Mi reivindicación cuál es? Que, no sé, estamos pasando un proceso duro, oímos muchas cosas, y que por un valor que no está cotejado dentro de ese protocolo, se pone en riesgo muchas cosas que a ti te suceden día a día. Digamos, la fatiga, ese ánimo que intentas llevar tu día a día y lo intentas conseguir, pero al cabo del día estás muerta. En el sentido de que tienes un cansancio muy extremo, los dolores de cabeza vuelven. En mi caso, me dejan fulminada porque son dolores muy, muy fuertes de cabeza. La visión del ojo derecho yo lo tengo borroso desde que empecé con la enfermedad. Me han hecho todo tipo me han mirado oculistas, todos enviados por el doctor, todos guiados por él, y no se va. Entonces, ¿por qué cuando un medicamento no funciona, ya se ha utilizado anteriormente, no he empezado de nuevas, he dicho, es la primera vez, no lo hemos intentado, cambiamos? ¿Por qué cuesta tanto un medicamento introducirlo a esa paciente porque realmente puede ser beneficioso y quitaríamos a lo mejor muchísimos problemas. Entonces, bueno, pues es un poquillo mi corto tiempo de enfermedad que llevo. Nunca había padecido ni plaquetas alteradas, nada. Directamente vieron que había una fibra. Y bueno, pues el doctor lo que quiere pues es pues lo que me gustaría que todos los pacientes tuvieran un doctor que te respalde, que luche por ti. Pero claro, me resulta, no sé cómo decirlo, pero que nos pongan un protocolo a gente que no tenemos apenas medicación, porque hay poquita, hay mucho estudio, pero poquito a poco, pues esos protocolos, esos en los hospitales y demás, ¿cómo se lleva eso? ¿Cómo se decide ese protocolo? No sé cómo podría, no sé si me he explicado bien, espero que sí, espero que se haya entendido, pero bueno, necesitaba también decirlo, que creo que es importante que no nos pongan tantas trabas para tener que cambiar de una medicación a otra. Entiendo que son medicamentos nuevos, pero a veces se necesita urgente. Entonces, bueno, gracias por escucharme, de verdad, y bueno, me he atrevido, que no es poco.
Okay, let's continue in English. You're absolutely right. But I think this is a problem which we have to discuss internally in MP and Spain, because obviously, our colleagues from the United States and from Israel, very little they know about our internal local problems. But in general, I think it's a very common problem. I assume, in the States, it's a little bit easier because you have a totally different system than what we have in Europe. And in many other countries in Europe, it's exactly the same situation. And there again, you see, these are things where we would like, with MPN World, we really would like to fight, these things. People who knows me, they know I'm allergic to politicians. And I always said I will never have more than 3P. Will never say never. I'm fully involved in politics now. I had meeting in the Senate of Spanish government. I'm talking to the different autonomies. I'm talking to the responsible people. I have contacts in the European Parliament. I'm talking to Emma. All political situations. But I finally had to accept that this is necessary to do. Why? Just in order to try to settle these problems we have. But I see very little chances, because when I see what they are producing in Brussels, it's just all negative. You're working in researches, and we have these clinical trials, and I think we had in Spain we had some very good rules. But now I think the common market decided to make these rules even a bit more stricter and more European. So again, it's a new step backwards in clinical trials, as far as I understand it, and I'm no specialist in that. But they told me that it simply takes away at the end time from using the product within the realistic period. So politicians are in general, making life more difficult. They don't make your life more easier. But on the other side, I notice a lot of reception from most of the politicians to what we want to do, and we do it on the local Spanish sphere. So maybe we will be able. I mean, we have one product which is Bezremi, and it has been approved by EMA 4 years ago. We still don't have it here. There is this famous story. Dr. Barbui, Professor Barbui, a very famous Italian researcher, when the discussion was in Italy about the acceptance of his product, he went to the Senate, and he explained to the Senate, how good the product is and that the people needs it, and okay, they accepted it based on his explanations. I managed to bring Dr. Barbui twice to Madrid to the responsible department for the acceptance, and he explained it. But I assume that when he did it, the windows were open because the wind took out the words, you know. So because nothing happened, we still have no Miss Remy. We are fighting it. We are, you know, doing whatever we can. But these are the political problems, unfortunately. But I'm confident, you know, part of it we will solve, I'm sure. Okay?
I try to explain it in English.
Yeah.
What happened with momelotinib, that is an excellent drug, and
Can you
is
put
that
is it on?
it's green? It is
Yeah, but closer, keep it closer. Yeah, yeah.
Is that we have access in Spain, that is, I don't know, anywhere else, by a compassionate use program. This program is a kind of clinical trial also. It's not a everyday practice. So the health authorities let us use this drug, but we have to follow the indications that are going to be approved in the future. And because it's really close monitor, happen is that if you don't have less than 10 of hemoglobin, you cannot use this drug. You have to use something else. You can use Ruxo, you can use fedratinib, you can use something else. That's why we are not allowed to use it without taking into account those criteria. It's not a protocol. It's like we need to use that criteria. Once this drug is approved and we can use this drug as we use Ruxo or as we use fedratinib, we are not so tied to these criteria. But because it's a compassionate use program, that's why it's so difficult. And here, not that I love them, but politicians don't have nothing to do. It's just the way we can have an early access to this drug, because in Spain we don't, if not were for this compassionate use program, we couldn't use it. So we have the lucky of having an early use for that, but so but all these come because you saw these trials. Well, this drug has been tested for a wide population of patients with myelofibrosis, but in the population that has shown to be better than our actual treatment is in that population. That's why they approve it in that population. Once the drug is available out of clinical trial, out of these compassionate use programs, we will be able to manage easily the indication. A little bit, but easily. I hope we don't have to wait so long.